This is my room where I'm doing my assessment. My head to toe assessment. So, ready? Hi.
Hi.
I'm Julie. I'm your student nurse today. I would wash my hands and close the curtain for privacy. Can you tell me your name and date of birth, please?
Matthew David Weimerskirch, 7/11/87.
And I would also compare that to my orders. I would wear gloves if I needed to, and today it looks like we're gonna kinda do a head to toe assessment, look you all over. Is that okay?
Sure.
Alright. So the first thing I would do is check a blood pressure, so I'd make sure that you're resting for 5 minutes before I took your blood pressure. Doing the two-step method, I would place the cuff on the arm, listen with my stethoscope to a brachial artery. Pulse, when I inflated the cuff, when I find my pulse, I would add 20 to that number that I found, and then I would check your blood pressure, adding the 20. So if I got like 110 with my brachial pulse, I would start at 130. And then go down. So if your blood pressure was, I don't know, 125 over an 80, that's pretty normal for a man your age. If it was like 180 over 66, 68, a little bit elevated, I would notify a physician that you do have elevated blood pressure. The other thing I would do is check for an apical pulse as well right away. So how you do that is you find, expose the patient's chest, which I'm not gonna do for this purpose. Find the angle of Louis to the second intercostal space and go down to the third, the fourth, and the fifth, and then over to the midclavicular line, which is the apex of the heart. And I would listen for 1 minute, listening for an apical pulse. Anywhere from the ranges of 60 to 100 is pretty normal. And then starting my assessment, I would first start with your head, so feeling your hair, black, thick hair, making sure there's no lumps or bumps or bruises, and anytime I'm doing this assessment, if you have any pain, let me know, okay? So hair looks good, scalp looks good, no abnormalities there. Facial features, so as you walked in today, I was kind of looking at your facial features, that you can look at me, I can look at you, that you can smile. There's no sagging or drooping on either side of your face, which is a good sign. I'd also inspect your nose for the shape of your nose, looking for any drainage, discoloration. I'd have you raise your head and look into your nose, looking for any kind of mass or abnormality in your nose that I would note. Also with your nose, I would feel your sinuses. I'm just gonna press on your face at your maxillary and your frontal sinuses. Any pressure there?
Nope.
Any pain or pressure would be like a sign of inflammation. We'd wanna note that. The nasal cavities, which we already looked into your nose. We would also look at your lips and your mouth, so since you're my husband, I will. So if you open your mouth, and I would look at the inside, outside of your lips, noting any kind of discoloration, mass, inspecting the teeth. Lift your tongue up for me, put it down. Can you go side to side with it so I can look inside? Looking at your tonsils and your uvula, stick your tongue out and say, ah. Okay, no abnormalities there with your mouth or tongue or teeth. We would also inspect your tonsils and your oral pharynx, which we did when we opened your mouth. Moving on to your lymph nodes, so your lymph nodes all over your head and neck we will look at. So first would be your preauricular, and I'm feeling for any kind of mass or large swollen lymph nodes. Postauricular, occipital, submandibular, submaxillary, post cervical, precervical, supraclavicular line. There's a lymph node down there you might feel that's inflamed, and no inflamed lymph nodes is a good sign. Also when you're doing that, I'd be looking at your skin, looking at the color, right here up here in your clavicle. I'd check your turgor, which is pinching of your skin, not noting any discoloration, any kind of masses or anything like that. You don't have any, but one of the most common is pustules, which is like facial acne, which would be a very common thing to find. Looking at down your arm and your skin, also looking at your fingernails is big, so looking at the color, shape, kind of the firmness of your nails is a good sign. No abnormalities there. Can I have you stand up for a second and we'll do your spine. Try to stay in front of them. Oh, this one, there we go. So I'd have you bend over a little bit, assessing your spine, looking for any kind of curvature of the spine. A S-curve is scoliosis. If you stand up straight, and if his back was arched in right here in the lumbar area is lordosis, and a big hunchback is kyphosis, which I don't see any abnormalities. You can sit back down. Another thing with skin is the edema. So big thing is in the morning checking for edema in the legs. So if you had like a 2 millimeter depression would be a +1 on the edema scale, and you have nothing, but you definitely want to check that before you get up out of bed in the morning. The other thing, when you came in, I would be looking at your walk and gait, making sure you're balanced and not off balance. The other thing we could also do is a Romberg's test to test your balance, which I'd have you stand up and close your eyes, and if you swayed or fell, that would not be a good sign. So then we'll move on to your eyes. So I'm going to ask you 3 questions about your eyes. Obviously you have glasses, but you wear contacts.
Yes.
Have you noticed any changes in your vision at all recently?
No.
And any history of glaucoma?
No.
Good. One of the things we would do with your eyes is look at your external structures. So like your eyes are symmetrical, there's no drooping or sagging. If you pull your glasses off for me, I'm also looking at how your eyes track. And yours are not symmetrical track without your glasses on, so I would definitely note that. The other thing I'd look at is looking at the conjunctiva of your eyes, which is nice and pink, and the sclera is bright and white, which is good. We'd also look at your pupillary responses, so I would dim the lights, but not possible here. So I would shine your light in the eye and see that your pupils dilate. And it does. I'm gonna do the other one. And it does. And then I'm gonna do it one more time and looking at the opposite eye and making sure they accommodate appropriately. And they do. Good. You put your glasses back on. Your visual, we can do the visual fields. So we could do, when you see my hand come into view, I want you to tell me. I'm just gonna check your field. So I want you to cover one eye. So I'm gonna come from the top.
Yep. 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 Yep.
And do the opposite. I'm just checking your peripheral vision.
Yep. 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 Yep.
Okay, and then we'll do your 6 cardinal gazes. So with both eyes, not moving your head, I want you to follow where my fingers go. And the other thing I would have you do is read. Can you read my shirt for near vision?
The Midwest girl.
Thank you. Sorry, I didn't have a piece of paper. I think that's it for that one. So next I would move on to is your ears. So I'd ask you 3 questions about your ears too. Do you have any hearing loss?
No.
Any history of ear infections?
No.
And any pain in your ears recently or
No.
new? The other thing I would do is visually inspect the outsides of the ears, looking for any kind of redness or discoloration again. Also feeling the ears palpating, and I would do them bilaterally. So I would pull on the pinna, fold the pinna, press on the mastoid process, and press on the targus of the ear. Any pain? And I would repeat that on the other ear, but for time I'm not going to do that. Also, I would look into the ear with an otoscope, pulling on an adult, pulling up on the pinna of the ear, looking into the ear with the otoscope, looking at the ear canal and the tympanic membrane, and I would repeat it on the other side. The last thing I would do, if you could sit forward just a little bit, I'm going to kind of do a hearing test, so and stand a foot or 2 behind you and tell me what side.
Right. Left. Right.
Perfect. You can sit back and your hearing's good. Moving on to some of the neuro stuff of you, of an exam, of a neurologic exam. First thing would be is I already asked you your name and date of birth. So some of the indicators are person, place, time, and like situation. So if you could tell me the time, I'd give a watch on.
9:05.
And where you're at.
My living room.
Also accessing memory. So some like recent memory would be how you got here today. how'd you get home from work, I guess?
I drove.
Okay, I'm gonna give you 3 numbers and I want you to repeat them back to me. 4, 15, 20,
4, 15, 20,
and repeat them backwards to me.
20, 15, 4.
And you already told me your birthday, so person, place, time, and place are good, so alert and oriented times 4, that would be, and your memory seems good, cause you repeated those things back to me. The cranial nerves, so we would have to test all of your cranial nerves. So, the first one would be olfactory, so if I had something to smell, say, an alcohol pad, or what would I have you kinda do it, like a lime or a lemon, I could have you close your eyes and wave that in front of you, and have you tell me what that smell is. If you could indicate that smell, that is a good sign that your olfactory nerve is working. Optic nerve, which we did when we did the 6 directions when you looked. The ocular motor, trochlear, and abducens we did with the 6 cardinal gaze as well. The trigeminal nerve, I would have you close your eyes, and I would touch your face, and you tell me if you can feel where you feel that touch.
My left cheek, my chin, forehead.
Okay, so that's good, that in your trigeminal nerve is intact, or facial nerve is intact, that you can feel sensation is a big thing. Acoustic, which we did with the hearing test of rubbing the fingers. The glossopharyngeal, which I kinda did with the oral one, I had you open your mouth and say ah when I looked into your mouth to look at your tonsils, which is an indication that one's working. Your accessory nerve, I just have you shrug your shoulders, it's going down. And then hypoglossal, which I also could have done when I did your mouth, but stick your tongue out and wiggle it side to side, is that one. So that would be your cranial nerves. Fine motor, I would have you finger to nose, so I'd have you touch your nose and touch my finger with one finger up and a pointer. So touch your nose and then touch where my finger is. Nope, with that hand. And back to your nose, and where my finger is again. Back to your nose, and up again. Kinda hard. Moving on to, I think respiratory is next. So I'd ask you 3 questions about your respiratory history. Do you smoke?
So,
Any trouble breathing?
no,
And any history with sleep apnea or COPD or anything?
Nope.
Okay. One of the main first things you would look at, what you could look at right when you inspect coming in, is their AP to lateral ratio. So one lateral side should be 2 anterior sides, and vice versa posterior. So AP lateral ratio, stating that you're symmetrical, your chest is symmetrical. Also inspecting like no big barrel chest or anything like that, which would be something we'd wanna put down in our assessment. I'm gonna track back quick, but one of the things I forgot with the neural test is the Babinski response, so I would take a pen, if you could lift your foot, I don't know if we can get it on camera. I would rub my pen on the outside of his foot to the tip of his toes, looking to see if your toes flexed out, and that would be a finding we'd wanna indicate is in the Babinski assessment. Back to respiratory. So I guess the look, listen, feel, so we kinda look at the chest, look at the color, definitely have him take his shirt off for that. Always, when we listen, we always wanna do skin to skin, for the sake, I'm not gonna have him take his shirt off. So then the next thing I would do is feeling for any kind of fremitus, mass, any kind of tenderness. Do you have any kind of tenderness? And then I would do the same thing on the back, if you could lean forward a little bit, is feeling on his posterior chest, feeling for any kind of mass, crepitus, or tenderness. For listening, you can stay just like that. For listening for respiratory, for breath sounds, I'm gonna listen to 18 different spots with the diaphragm of my stethoscope on your back. The first 4 I would have you deep breathe, so just the first 2 deep breathe for me so I can hear. Okay, one more. And then 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19. And I would be verifying side to side that those sound the same. Then going to the front, there's 10 sounds on the front. that you would listen for respiratory. The first two take deep breaths for me so I can hear, and then we'll just count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. The other thing I would do for respiratory, if I could have you, can you stand up one more time for me? Turn around so we can see it on the camera. Turn more. There you go. So I would place a W on his back, with my thumbs together, looking for chest exertions. I'd have you take one deep breath in and blow it out. And looking for my thumbs to expand and contract back in with his breath. Okay, that looks good. Then moving on to cardiovascular, I would ask you 3 questions about your cardiovascular history, of course. Do you have any shortness of breath, which you already answered no? Do you have any history of chest pain? And any history of a heart attack at all? Okay, same thing with the chest. You would definitely want to inspect the chest with a shirt off, of course, skin to skin. We would also look for jugular vein distension, so looking in his neck. You look for any kind of bulge in his neck on either side, and if you did, you would lay them back 45 degrees and look for jugular vein distension again, and if you saw it then, you would definitely notify a physician right away of that. We would listen after we felt the precordium, palpated everything and felt for any kind of pulsation in the chest. We would listen. When you're listening to cardiovascular sounds, you would listen to the bell and the diaphragm of your stethoscope, noting both sounds. So this time I'm going to do my diaphragm, but I'm listening to all your heart valves in your heart. And to find those, you would find your angle of Louis again and go to the right side to the second intercostal space is where your aortic valve is. Again, skin to skin. You'd move to the left to the pulmonic, to the third intercostal space to the Erb's point. Fourth would be the tricuspid, and fifth midclavicular is your mitral valve. And again, I would do that again with my stethoscope all the way down on the bell side. Some of the key points you're looking for is your S1 and S2 sounds. S1 is heard at the tricuspid. S2 would be heard up at the pulmonic aspect when you're listening. The other thing we would do is palpate your carotid arteries one at a time, making that we feel a pulse bilaterally the same. And I do, and the other thing we would do is listen to your carotids. So I'd have you turn to the right and hold your breath with the bell side of my stethoscope. Okay, breathe, and then turn to the left and hold your breath. Okay. The other thing we would do is check all your peripheral pulses. So starting at the head are your temporal arteries, feeling bilaterally again if you can feel pulsations on both sides of your body. Carotids one at a time. Brachial arteries. Radial arteries. Femoral arteries, popliteal. Posterior tibia, and dorsalis pedis on the top of the foot. And all arteries peripherally feel the same. Last is abdominal assessment. So first I'd make sure you went to the bathroom before I started pressing on your belly, things like that. Then I'd actually have you lay back if you could. Lay back on the couch. I'll make sure the camera can. And I put a pillow under your knees. Yeah, I think you can see. I'd ask you 3 questions about your abdominal history. Have you ever had abdominal surgery?
No.
Do you have a history with constipation?
No.
And do you have any issues with nausea, vomiting on a regular basis?
No.
Okay. First thing I do is have you lift your head, and I would inspect his belly, for any kind of bulge or anything you can rely. Bulge or anything for a hernia, which there's no noticeable, anything in your abdomen. Looking at the size, shape, and contour of your belly, make sure you don't have like a big kind of beer belly, convex or concave belly, that it's symmetrical. If you weren't symmetrical, it maybe would show like a hernia also. Looking at the skin integrity, skin is intact, good pale color, intact skin. We would listen to the bowel sounds with the diaphragm on my stethoscope. In all 4 quadrants, so you're just gonna hear me listen. Of course, skin to skin on a normal patient. And then I would turn it to my bell side, listening to your arteries in your abdomen. So the first one is the aortic, the renal, the other renal, and comparing them bilaterally in the iliac. Okay. So it would be the listening feature of the abdomen. In the feel, first I would percuss, so you're gonna feel me hit you in 4 different spots. And then you would also palpate all over the abdomen, looking for any kind of tenderness, swelling, see if you're full of stool, but you're not. You would feel that. Alright, so, going back, the other thing I would check is when I looked at your fingernails, I would check for capillary refill, so squeezing your fingers, making sure the color returned to your nails in a timely fashion, and also doing that on your toes, checking the capillary refill of your toes, which looks good, your refill's really quick. The other thing I would do is feel your joints bilaterally, so if you feel pain in any areas that I'm touching, you need to tell me that. So feel your shoulders, your elbows, maybe your knees, any pain, or you would notice any swelling, uncross your feet, and your ankles. And then your muscles, we would test all your muscles and your range of motion bilaterally to make sure you're not weaker on one side or stronger on another. So the first thing we would do is check your sternocleidomastoid muscle, so I'd have you turn your head, I'm gonna press against you, so turn this way, and turn to the other direction. I would test your trapezius muscles, which by shrugging your shoulders, I'm gonna push down. I would test your deltoid muscles, so arms out like this, and you push up. Okay, good job. Your biceps, like show me your muscles on your arms, so biceps and triceps, and the same over here, biceps, triceps. Hold your hands out in front of you like this for your wrist. You push against me, and vice versa, your hands and wrist. Fingers, I'd have you squeeze my fingers, give me a tight squeeze. I would do your hips, so your knees, I would have you push out and push in, abduction, adduction. Quadriceps, triceps, I would just work against me. You push in, and I'll push out. And in, and out. And then your feet and ankles, I'd have you push your toes all the way up in the air with your heels on the feet and step down. Perfect. And I think the other thing I would do for respiratory, I would be checking your respiratory rate. By doing that, I would feel your radial pulse, but really I'm watching your chest rise and contract, being 1 respiration. I would count that for 1 minute. And watching your effort to breathe, watching your rhythm, that it's a continuous pattern, that you're not gasping for air or anything like that, or struggling to breathe at any time in that 1 minute by counting. That's it. You just think one more time, make sure I didn't forget anything. I think that's it. So then I would complete with, is there anything else I can do for you today? And that ends our head to toe assessment.